Hello emergency department physicians. We have completed the pilot implementation of the Canadian Syncope Risk Score at the Queensway Carleton Hospital, and we are switching to the RAMO-Sync trial, which is remote cardiac monitoring of at-risk syncope patients after emergency department discharge. The primary objective of this study is to compare the proportion of patients with arrhythmia identified that required treatment between the two study arms, which are 15-day live cardiac monitoring versus usual care. Patients with a Canadian Syncope Risk Score of more than equal to 3 and are being discharged from the emergency department are eligible to be included in the randomized controlled trial. Patients with score less than 3 will be included in an embedded observational study. The secondary objectives of this study are to assess the 30-day outcome for all patients, reevaluate the optimal duration of monitoring, and reconfirm the accuracy of the Canadian Syncope Risk Score. For potentially eligible patients, clerks at triage will attach the pink study form titled RAMO-Sync RCT. This form is similar to the completed implementation study form. Complete patient and physician initials. Ensure the patient fulfills inclusion and does not have any exclusion criteria. Then complete the Canadian Syncope Risk Score and calculate the total score for your patient. As a physician, you will ensure that the patient fulfills the inclusion criteria, which is an adult patient presenting with true syncope within 24 hours of their episode. True syncope is transient loss of consciousness followed by spontaneous complete recovery. Make sure that the patient does not have any of the below-mentioned exclusion criteria, which will suggest that the patient either did not have syncope or risk stratification is not needed. Prolonged loss of consciousness. Significant trauma requiring admission. Any mental change from baseline as described. Loss of consciousness which happens with witness seizure, or with alcohol or drug use and GCS less than 15, or is associated with head trauma. And lastly, any serious condition identified in emergency department that requires hospitalization. Let us look at the Canadian Syncope Risk Score itself. There are 8 predictors in 4 categories: clinical evaluation, electrocardiogram, lab results, and presumed emergency department diagnosis. Clinical evaluation. Did your patient have a predisposition to vasovagal symptoms, any history of heart disease, or abnormal systolic blood pressure during the emergency department stay? Electrocardiogram. Does your patient have any of the following electrocardiogram abnormalities? Remember, for QRS axis -29 is more than -30 and -31 is less than -30. Lab values. If a troponin was drawn, was it elevated? A positive troponin value is above the 99th percentile or 14 nanograms per liter at the hospital. If a troponin was not measured, select not done. Lastly, what is your diagnosis at the end of the emergency department visit? Vasovagal syncope, cardiac syncope, or other. Please select only one of the 3 options. Calculate the risk score as shown. If the total score is 3 or more, and the patient is being discharged from the emergency department, please request permission from the patient to be contacted by the research team. Indicate if you would like an outpatient cardiology follow-up for this patient. Once the patient agrees, please complete the form and ask the ACC to fax the form to the number provided in the form. Leave the completed and faxed form in the designated tray in the emergency department. Call research team at 613-823-1299 so the team can contact patient for enrollment. For patients with score more than and equal to 3 and not interested in the monitoring study. And for patients with score less than 3, please obtain permission from the patient for research team to contact the patient for 30-day follow-up and use of leftover blood. All details about this embedded observational part of the study will be explained to the patient by the research team during the follow-up telephone call. One major difference between the completed implementation study and the new monitoring study is that monitors are no longer available in the emergency department for distribution by department staff. You will have to call the study team for enrollment and randomization for any eligible patients. Some tips to keep in mind. Only complete the form at the end of each emergency department visit. Please remember to obtain permission from the patient for contact by the research team. For patients with score more than equal to 3, indicate if cardiology follow-up is required. For patients with score less than 3, obtain permission for research team to contact them for 30-day follow-up and manage these patients as per usual care. Please complete the form at all times 24/7. If you need to contact the research team, call 613-823-1299 between 7 a.m. to 8 p.m. every day. For those not enrolled in the monitoring study, patient infographics provided at the emergency department can be used for discussion. Refer to the study posters in the emergency department for details. Thank you for your contribution towards research.